5 dreadful symptoms of deadly diseases. Number 5. Forgetting to breathe. People sometimes forget to breathe. When pressure begins to build on the brain for whatever reason, be it due to a large bloody stroke, an expanding tumor, or the accumulation of water within the brain matter, the brain is eventually pressed against the skull. This often affects the breathing centers, located in the brain stem. So yes, the age-old joke of someone forgetting to breathe actually comes true. It's far from being a laughing matter in real life, however, as it often signifies a buildup of intracranial pressure that may eventually end in death. Number 4. Dancing. You know that feeling when you can sit still and the beat of the music just takes over your body? We're not talking about that. In the medical field, music and dance inclinations aside, there exist several severely degenerative diseases that result in the patient having uncontrolled, jerky movements, otherwise noted by non-medical individuals as a form of dancing. Such movements are referred to as hemiballismus and result from certain portions of the brain losing their inhibitory control of movement. Though quite interesting at first glance, the symptom is quite debilitating and oftentimes requires an intensive amount of medications to keep the patient from moving or exhibiting jerking movements. Number 3. Hypersexuality. It's joked that men are from Mars and women are from Venus, but it turns out that the human sex drive is written into deeper parts of the human brain. Hypersexuality and inappropriate sexual behavior are all part of a group of symptoms that describe Kluver-Bucy syndrome, a rare disease often seen in people who have sustained large amounts of damage to the portions of their brain responsible for keeping these emotions in check. Unfortunately, no amount of psychotherapy or medication can truly correct this disease. Often, patients are left highly irritable and, well, aroused by pretty much anyone and anything. Number 2. Burning up. Have you ever been so mad that you felt like you could erupt into a fiery inferno of hatred and spite? Medically speaking, the closest you can possibly get is malignant hyperthermia. This is a rare condition that occurs after undergoing surgery, specifically after undergoing general anesthesia. Body temperatures can get close to 41 degrees Celsius, causing tremendous damage to tissues not used to such an elevated ambient temperature. Malignant hyperthermia is often caused by an inherited defect in an individual's normal temperature response. Unfortunately, most people who suffer from this are often unaware that they have the mutation until they're sent to intensive care after surgery, thus giving a new meaning to being hot in bed. Number 1. Fear of water. We've all seen cats and dogs exhibit aversions to water. But can it ever happen to humans? Apart from fear of drowning, the fear of water, specifically of swallowing, has often been seen in cases of rabies. Sufferers don't truly fear water. The rabies virus triggers a severe muscle spasm around the throat. Those who've succumbed to the encephalitic stage of rabies display a severe aversion to and difficulty with swallowing, making it appear as though they have a fear of water. Rabies is highly fatal disease if untreated, so if you've sustained a bite from a suspected rabid animal, go to your local hospital immediately.